My name is Mike Ruma. I'm a maternal fetal medicine specialist. I work at Perinatal Associates in New Mexico, and what we're going to talk about today is the Epic and Affinity ultrasound platforms, the latest release of software, which incorporates a variety of new features. We're going to use this new tool that sculpts and removes the extraneous information that we have on the side, uterus and placenta, and that's called A-reveal. And watch what A-reveal will do to this volume. It helps to illuminate and show the face off in a quick fashion without having to sculpt any information. TouchView is very interesting because instead of using rotational knobs to change the volume, you can simply use your hand. And not only can I rotationally use two fingers to move this in a Z-plane like that, I can use a single finger to move the volume in an X as well as Y plane. And then we are going to bring up TouchView to be able to put the light and drag the light for the patient, yourself, around the volume in an intuitive fashion, just like any smartphone at home. You can double click and place the light in multiple different places, and you can also bring the depth of the light in to provide some unique shadows and illumination to the fetal face. I can also rotate the baby using 3D TouchView. You can see how the shadows move in a realistic fashion, in a very smooth and fluid fashion using TouchView, available on the Philips, Epic, and Affinity systems. TrueView is quite remarkable. You really get a true sense of what it would look like in absolute photorealistic fashion. The colorings, the shading, the tones are truly realistic. When we move to TrueView imaging, we have this pink hue that alone is simply coloring. But as you can see, what I've done here is I've brought the light actually within the left ventricle using the depth capacity, which is unique to TrueView, and allows the light to enter along a Z-axis. And the light here in the left ventricle, as we've placed it there, allows us to see an illuminated left ventricle, the mitral valve. And what's very interesting to me is that the light actually penetrates into the left atrium, illuminates the top portion of the wall of the left atrium, but does not at all enter the right ventricle with no penetration through the ventricular septum, so that the light is actually acting as it really would if I put an orb of light within the actual cardiac volume. This personally helps me have a bit more confidence that there is no evidence of ventricular septal defect, and if there were, we would anticipate seeing light emanate into the right ventricle. So as we see GlassView and we move into GlassView analysis from TrueView, I think of GlassView as looking at kind of a plaster of Paris poured into the cardiac volume and then removing the cardiac myocardium and being able to look into the chambers, the volume of the chambers, kind of in a translucent fashion. For me, what I can identify here is the left ventricle. I can see the aorta leaving the left ventricle, the right ventricle, and the pulmonary artery leaving. But what's particularly important in this imaging is that there should not be any fluid coursing across or any evidence of a chamber coursing across the intraventricular septum, and I actually do not see that, which I believe is a good thing. Again, helping us provide clinical confidence that this is an intact intraventricular septum and that this is a normal cardiac septum present in this volume. And that, to me, is one area in which GlassView can shine and provide some clinical confidence for you and your patient. Philips has provided us with tools that were incredibly useful, faster, better image quality. We are seeing an evolution of ultrasound which is truly remarkable. The advances are truly useful. They are helping us with efficiency, they're helping us with detailed image quality, and providing the patient an incredibly enriched 3D volumetric experience. And I can't wait to see what the future is going to hold. The EL184 linear pure wave transducer is a very impressive transducer to me. I've been amazingly impressed with the detail, the black and white contrast, not only in the near field, but all the way throughout the far field. There's excellent penetration to the transducer. The image quality and the detail resolution is remarkable. Seeing skin outlines, bone outlines that are crystal clear and absolutely sharp is really amazing. You can make out an absolute exquisite facial profile. What I'm impressed with looking at this EL184 image is just the crisp lines around the skin edge, actually being able to visualize the nostril, exquisite representation of the upper and lower lip. You can see the tongue very easily here. The maxilla and mandible is present as well. I think you will be impressed to see what it looks like in your hands as well. What do you think about that profile?
I can see the ear more.
What do you think that little bit of anatomy is?
The nose.
Looks like the nose, right? You can make out a beautiful skin edge here. You can make out a nice nose, upper lip here. This is the nasal bone, which is very beautifully imaged here. EL184 helps us highlight the heart in an impressive way. What you can see in this image, which often is difficult to see, is a near field, far field contrast of the cardiac silhouette. What I'm impressed with is the ability to see the myocardium in discrete contrast from the pericardial sac. You can easily see the actual foramen ovale opening and closing. The atrioventricular valves, we have the tricuspid and mitral valve here that look beautiful, and the interventricular septum, moderator band is demonstrated to us, and overall just an absolute crisp design and representation of the fetal cardiac structure. Another area where the EL184 demonstrates some very strong prowess is evaluating digits. You can see the hands of the fetus here clearly representing 5 fingers. You can actually count the metacarpals present within the digits, things that we would not ever attempt to do with any other kind of transducer. We could potentially count fingers, but this is really remarkable imaging. EL184 linear transducer has the capacity to use microflow as well. And what you can see in this is a beautiful cord insertion into the placenta. Often difficult to see, but the low flow characteristics and capacity of looking for low flow perfusion is really the high point of the EL184 with microflow technology. Just able to come up with some beautiful imaging of the placental cord insertion. This probe has a significant future in obstetrics. I think it has a significant future in maternal fetal medicine. When we look at areas where we might particularly want to use this probe in personal usage, it has helped me identify nuchal translucencies in difficult scenarios where previous I could not identify the nuchal translucency at all. In cardiac abnormalities, in heart cases when there's are problems, delineating the underlying cardiac diagnosis is likely going to be much easier with this type of probe. The Philips V92 transducer, latest iteration in the 3D transducer family, really is a remarkable probe. It utilizes pure wave technology as an ultra broadband transducer, and that pure wave technology allows the probe to provide incredibly crisp 2D images with excellent penetration. You'll find contrast resolution throughout the entire imaging to be clear and concise. Really a single probe solution because the 2D image quality is that superb. And I think that you'll see the 3D imaging is excellent. Using the 3D, it's not only very quick, the 4D acquisition is speedy and very smooth. Color, pulse wave, M mode, all of those have been refined in this probe. In my opinion, the V92 transducer is an excellent new introduction and is one that I think you'll find to provide superior image quality and overall excellent imaging. We typically use 2D transducers in our practice on a regular basis as our mainstay for 2D imaging. However, the ergonomic design of the V92, I think that this transducer could be used on an everyday basis as a workhorse transducer to allow the user to not only achieve excellent 2D imaging, but also to be able to instantaneously convert to 3D imaging without having to go to the machine and swap out transducers in your hand. You'll find that this probe is extremely light, and in my experience is the lightest ultrasound probe that I have held when it comes to a 3D transducer in my career. It is really incredibly quiet as well. Initiating 3D 4D mode with this is nearly silent, and I think that you'll find that it's an excellent transducer when you put it to use as well. The V92 in this image here, you can clearly see the fetal diaphragm present. You get a very nice sharp outline of the diaphragm. There's a very beautiful uniformity of tissue present that's not always seen with all transducers. Different echo textures of the lung versus liver versus intestine. Amazing and incredibly superb image quality in the realm of surface rendering. You can see this true view image of the fetal face here, making out very nice full lips, differentiation of actually even the shadowing of the upper and lower lips, the philtrum, the nostrils are incredibly crisp. Patients, families, look at these images and are instantly astonished at how lifelike and photorealistic these images are. This is a 3D volume of the left ear, and I think you'll be quite impressed looking at the shadowing and the echo texture of this, that it really indeed looks almost anatomically as realistic as this may be in a real human exam. As you can see in this example, images 1, 2, and 3, all of the orthogonal MPRs, the quality of these MPRs is quite extraordinary. The V92 is light, it's extremely ergonomic, and it is easy to scan with. I seriously believe that this transducer could act as a singular solution for any practice that's looking to merge in a hybrid transducer, both a 2D high-frequency transducer and an excellent lightweight 3D transducer, and put them together, and you have the V92 as a wonderful solution for that person.
Okay, Dr. Daniega, ready ka na ba? Naka-break ka na ba enough?